Hello, my name is Samantha Hocking and I'm an endocrinologist with an interest in treating complex obesity and an academic at the University of Sydney. And I'm also the current president of the National Association of Clinical Obesity Services. As we've heard so eloquently described by our colleagues with lived experience, Andrew and Lisa, those who live with severe obesity live with multiple chronic health conditions that incur high healthcare costs and that require a multidisciplinary approach to care. As we heard from the Assistant Minister, obesity disproportionately impacts those in our society who are the most vulnerable. As they both described, this is a chronic health condition that cannot be self-managed, but it needs to be treated with empathy in a multidisciplinary setting. Obesity is the most common chronic disease that affects Australian adults. We have heard that affects a third of the adult population. To put that in context, that's 8 million Australians who are currently living with obesity. Now, despite this, a survey conducted in 2017 identified only 16 public hospital-based obesity treatment clinics across Australia. Almost all of these were located in major cities. Most have a long waiting list. In some cases, the waiting list is years. And unfortunately, most are also inadequately resourced. What this means is that most Australians do not have access to evidence-based therapies for the treatment of complex obesity, including pharmacotherapy and bariatric surgery. A very stark fact about bariatric surgery is that less than 5% of bariatric surgery performed in Australia is performed in public hospitals. This is the situation for adults, and unfortunately, the situation for children and adolescents is even more severe, with less services available. So we are asking for a call to action. All health services across Australia must have access to publicly funded multidisciplinary obesity care. This should span primary through to tertiary care, and this must be included in the National Health Reform Agreement. Thank you.